from Utah.
I ask unanimous consent to suspend the quorum call.
Without objection.
Madam President, I rise today to give voice to some of my fellow Utahns, including a few of my fellow Utahns who were suffering because of the health care law passed by this body nearly 7 years ago. These are not stories from wealthy Utahns who have simply had to pay higher taxes, nor are these stories from low-income Utahns who already had insurance through Medicaid. These are letters from the too often invisible victims of Obamacare, those middle-class families who used to be able to afford health care when they needed it, but are now forced to pay for it and to pay for what amounts to, in some cases, one of their largest payments or even their largest payment they make each month for a so-called insurance plan that never seems to pay out because of high deductibles. Jenica from Davis County, Utah, writes as follows, quote, "I'm an ordinary mother raising my kids and striving to live within my means. For the first time, my family is facing a year with no health insurance. Our gross income falls a few $100s per month too high for us to receive help through CHIP. But we cannot afford to purchase health insurance through my husband's work or through the marketplace. After this year's premium increases, the most inexpensive plan offered to us on the marketplace is a full quarter of our gross income per month before taxes. And if we put that into our budget, we will not be able to save any money to pay deductibles as healthcare needs arise. We face the same problem with my husband's work insurance. It would be even more expensive, and we cannot wisely budget a quarter or more of our income toward health insurance premiums. I know this problem is not limited to my family, and I want you to be aware of those of us who are falling into the gap this year. We earn barely too much to receive any assistance, but not enough to actually pay for insurance premiums. It seems the wisest course is for us to withdraw from insurance and save our money to pay for medical expenses in cash, as well as saving to pay the fine on our taxes next year. It is a decision I do not make lightly, as I know that the insurance companies need more people, not less, to participate to make the system work. However, my family cannot afford to participate this year. I know you will represent us and take our needs into consideration as you work with the other members of Congress to make our country's healthcare system work for all of us. Thank you for serving our state and country. May God bless you and your efforts. May God bless you, Jenica. May God bless you for having the courage to write these things down and to share them with your fellow Utahns and with your fellow Americans. I promise, Jenica, that I will do everything I can, everything within my power, to make sure that you and families like yours are not forgotten when we repeal this law and replace it. Trevor from St. George, Utah, had a similar story. He writes, quote, "I recently got a new job and I'm trying to get health care. None of the 3 plans my employer offers are affordable to me, even though the government claims they are. Even if I were to buy the cheapest plan, I would never be able to use it because of the high deductibles. I do not qualify for Medicaid and earn $1,000 per year, too much to qualify for subsidies. In a nutshell, I can't afford to buy insurance from anywhere, and by not buying it, I can't afford the penalty levied by the federal government. What is someone in my position supposed to do?" The ACA, he continues, is not helping the very people it was designed to help, and is in fact throwing a terrible burden on me and on my family. We need a new healthcare system. This one is not working. Please share my story so that others will be aware that people in my position, and there are many of us, are struggling. Close quote. I will share your story, Trevor, and soon we will be one step closer to a new type of system, a system that will put patients and doctors back in charge of healthcare decisions, rather than having those decisions made by government bureaucrats in Washington. The last letter I'd like to share today comes from Washington County, Utah. Ron from Washington County writes as follows, quote, "Today I received a letter from my health insurance carrier indicating that the premium for me and my 2 kids, yes, only 3 people, is increasing from $1,020 per month to $1,706 per month, an increase of slightly over $8,200 per year. My annual income for 2017 will not be increasing, let alone to cover $8,000. Later this afternoon, I'm contacting my travel agency, a local small business, and asking Judy to cease her research into my family vacation for the summer of 2017. Why would I cancel my vacation and take away revenue from a local small business? The answer," he writes, "is 67.26%. That is the percentage increase for my health care insurance." He continues, "I need you to see that as real. It greatly and negatively impacts my family, and it subsequently impacts local businesses, as more of my money is drained from the economy. I make roughly $60,000 per year. My medical premium is now 1/3 of my gross income. Plus, I still have to pay out deductibles and copays. Even the bronze programs, which are worthless, are designed to bankrupt a family and end up costing more in the long run, have exceeded the cost of the mortgage I took out on my St. George home in 2014. More than my mortgage, repeat, more than my mortgage. That should send shivers down anyone's spine." He concludes, "One of the most important aspects of America's middle class is the ability for a family to purchase a home. Now that insurance premiums have exceeded the mortgage payment of a median-priced home in the United States, I suspect that the dream is now slipping out of the hands of many Americans." Close quote. Ron, you're absolutely right. Thanks to Obamacare, the American dream is now slipping out of reach for far too many families throughout the state of Utah and throughout the entire country. Now, these are not just the stories of a few isolated Utahns. These are not just stories from a few statistical outliers. There are fewer affordable options for Utahns throughout the state. In 20 out of Utah's 29 counties, Utahns can only choose a health plan from one insurance company. They've got just one company to choose from. And the options available are not always as robust as they should be. Within those options that they have, the costs have risen far too much each year. For 2017 plans, insurance rates across Utah increased at least 30% on average. 30%. This is after multiple years of substantial premium increases in other years leading up to this. But fortunately, help is on the way. Thanks to President-elect Donald Trump's victory this November, and thanks to the outcome of House and Senate races throughout the country, we now have the opportunity to uproot this ill-conceived health care law, root and branch. Now, the old system, to be clear, was far from perfect. After we repeal Obamacare, we'll still have much work to do in unbundling health care from employer-provided health insurance so that doctors, nurses, patients, and innovators can do the work of bringing down prices and increasing quality. You see, Madam President, that is what happens when we allow the free market to operate. We get competition. And when people compete, two things happen that are important to consumers. Prices go down and quality goes up. That's what the American people have come to expect in basically every other sector of our economy. But sadly, we've seen the opposite become true with respect to our healthcare system under Obamacare, because we've restricted free market forces and we've thereby impeded competition. As a result, prices have gone up and quality, in some cases, has gone tragically down. But step one involves repealing this health care law. Trevor, Jenica, and Ron, I want you to know that I hear you. I hear you and I hear all Utahns who have contacted me to share their experiences with this health care law. And now my colleagues in the United States Senate have heard you too. We will repeal this health care law, and we will bring reform and competition to our nation's currently broken health care system. Thank you, Madam President. I yield the floor and note the absence of a quorum.
The clerk will call the roll.
Mr. Alexander.